Right. Dr. Redfield, you were looking to jump in. Did you have some?
Well, I was just talking about the importance of investment in public health. I was going to add, when I was able to be the CDC director, one of the things that was clear to me was that we had 40,000 people a year, each year getting HIV infection, but we had all the tools to prevent that with antiretroviral therapy, with diagnosis, with treatment for prevention, and to try to begin to work with OMB to let them understand that when you looked at the 40,000 cases per year at over 10 years at, 500, 600, 700, $800,000 a person, it got into enormous amount of money, a quarter to a half $500 billion. It made a lot more sense to invest in public health, whether that was investment was $100 billion or $200 billion, and try to help bring an end to new infections with HIV. So I think it's so important, as Julie pointed out, it's not about the cost, it's about the savings. I would argue that in general, investments in public health have substantial savings, not to mention the impact it has on the human condition. And unfortunately, the system, the way they do that, we were able to get it through OMB when I made the arguments, but it's complicated because they want to look at everything on an annual basis. And I think there's many ways that public health can generate substantial health savings and should be invested. I think the biggest issue that I will continue to say is that our proportional investment in public health is just highly inadequate. And we need to think about it. Like Tom said, I spent over 20 years in the Defense Department. We need to think about it proportional to our investment in the Defense Department. This is probably the greatest threat to the United States in terms of our way of life, is not our relationship with North Korea, or Iran, or China, or Russia. It's really the pandemic potential. And the fact is, we're not prepared for that pandemic potential. Even if we can get the science right, we don't have the manufacturing capability to be able to develop the countermeasures. And we really ought to re-look at the threats that we have in this nation and make public health one of the major investments that our nation makes, proportional to our Defense Department.